So our presentation is on emerging global health concerns. And an introduction to global health concerns. Global health, when defined by St. George's University, is the understanding of healthcare at an international and interdisciplinary level. And it includes the research, study, and practice of medicine with a focus on improving health and healthcare equity for populations worldwide. So some of the 6 emerging issues that we're going to discuss are pandemics, environmental factors, economic disparities in access to food care, political factors, non-communicative diseases, animal health, and food sourcing and supply. So first we have pandemics, and pandemics is defined as global disease outbreaks, and these most often originate from animals. And some pandemics that you obviously have heard of recently include the 1918 Spanish flu pandemic, the HIV/AIDS pandemic, the 2009 swine flu pandemic, and the 2020 COVID-19 pandemic. And these pandemics showcase how vulnerable humans are to widespread diseases and how they can affect everyday life, which obviously we have all seen through the COVID-19 pandemic. And some other concerns that arise from these are vaccination efforts and universal health education, because everyone was affected some way by the COVID-19 pandemic. And pandemics can create widespread fear, and so nurses have to learn to deal with this stress while helping their patients remain healthy, and as well as helping protect themselves.
Another factor is environmental factors, and there can be a variety of disease according to the type of pollution, and pollutants can take many different forms. And this type of disease can be seen more clearly in developing countries due to the lack of hygiene and sanitation. And these are diseases from water and land pollution, and these are diseases from air pollution. The next factor is political factors. Each country has different policies and budgets about health concerns, and each country has different regulations of environment and pollution that can impact on health. WHO estimated that a minimum health budget of $34 per person per year would save 8 million lives and $360 billion. Effective international cooperation is vital. And the next one is non-communicable disease. The World Health Organization, WHO, reports that non-communicable disease kill about 41 million people each year. This causes 71% of deaths globally. And these diseases are chronic diseases. So nurses add in the education of NCDs to people. They teach principles of healthy lifestyle to their patients because avoidance of NCDs is much easier than treating NCDs.
Another global health concern that is emerging in our world today is economic disparities and access to global health care. So despite what we see in countries such as United States, England, and France, many communities in the world still lack access to basic healthcare and knowledge. And some ways that we can combat this is by encouraging physicians and nurses to practice in remote, underprivileged areas. And a great example of this is the Frontier Nursing University, who has encouraged nurses to go into remote, rural areas since the 1960s. How all of these health concerns impact modern nursing is because nursing is a field that is constantly changing with globalization. And as we've seen with the COVID-19 pandemic, the world is connected through travel, and the lives of people all over the world are connected. Disease spreads quickly, and nurses are needed for controlling and stopping the spread of these diseases. And many low-income or poor communities are at risk because of the lack of basic health care, and nurses are the best career to be able to help these people. And the encouraging thing about globalization is that it has led to improvements in the healthcare system through human rights and low-cost technologies. Many remote and rural areas do not have enough money or means to set up full practice with a doctor, so sometimes nurses are all they have to be able to help these people live healthy, good lives. And nurses are advocates for both patients and healthcare professionals, and they can represent people of all walks of life. And as more global health challenges arise, nurses are often the first that are called upon to help.